Okay, Mr. Manuel. A healthcare task force study showed that 20% of Collin County residents don't have healthcare insurance. Is it the commissioner's role to try and decrease that number, and how do you propose we do that?
It is the job of the county to service our indigent population. The state of Texas mandates that the county provide health care for all people below a certain percentage of the poverty level. I believe the state mandates at 21%. Collin County, which has taken the step of going up to 100% of the poverty level. And the best way for us to manage that is not simply to shuffle people off to Parkland or to allow them to end up in a private hospital emergency room. It's more than anything else, in my opinion, to push for better usage and wider usage of the non-profit healthcare clinics throughout the county. Now, these clinics are already trying to do the work that we're needing. They're already trying to service the indigent population, regardless of where they come from, and we can help further that along at $10 a person, as opposed to letting them go out to Parkland, where it costs hundreds, or even a private hospital, where in the end your insurance payments are going to foot the bill. So this is an issue where Collin County has a set amount of responsibility, but the more we tackle that in a proactive manner, the better we'll be able to give our citizens some relief, because we're not wasting their tax dollars in areas where they shouldn't be spent. I believe that we can definitely improve and work with our relationship with Parkland and with the private sector hospitals by giving them a better understanding of where we stand and sharing data back and forth in a way that helps us manage the amount of money we're spending in those entities.
Mr. Jaynes?
I think the hospitals have a clear understanding on where we stand. We're probably the best as far as any suburban county out there. State law says 21% of the poverty level, you have to provide indigent health care. Well, that 21% of the poverty level, a family of four makes over $4,000 a year. They do not qualify. Picture that in Collin County. We went up to 100% of the poverty level, more than any other, again, suburban county in the state of Texas. And we've also decided that we need to have more public-private partnerships with our health care. Instead of just having a county health clinic where people can go between 8 and 5 Monday through Friday, we've also partnered with Prime Care. We're starting to partner with private doctors to where a person comes into a health clinic, they sign an affidavit, I do make 100% of the poverty level or less, I am a U.S. citizen. They do a $20 copay, which I think is important that they have an investment in, and Collin County picks up the rest. As far as Parkland, everybody who our doctors have referred down to Parkland, we do pay the bill, and we're very good at paying our bills. I must say Collin County is the only county that can provide this kind of service. We're also the only county in the state of Texas that does not have part of their tax rate going to health care. Some cities, some counties have a hospital tax, a whole separate taxing entity. By selling the old hospital in the 80s, we've been able to invest that money and invest it wisely, and we're using the interest off of that to fund our indigent health care program.
Manuel,
well, I do want to mention, Joe's very correct. We are one of the few that do not currently have a hospital tax, but I want to add that we're in danger of getting that because of our poor relationship with Parkland. Parkland Hospital sent us a bill for $5 million in 2006, of which we paid $71,000 because that was the amount that the county itself had sent down. They sent us another bill in 2007 for $7 million. This money doesn't just disappear if we don't pay it. It ends up being paid by the state. And so Parkland is pushing to get that money funded by a tax that would be levied by the state upon Collin County. It's important for us to build up that relationship to work with Parkland instead of getting billed by a higher level entity.
Well, Collin County, like I said, pays for every person that is sent down to Parkland. As we were talking earlier, if you have a contractor out here and his roofer falls off the house and injures himself and he drops him off at Parkland, I don't think the county taxpayer should be responsible for that. The county taxpayer should just be responsible for who Collin County sends down there, which we pay that bill.
All right, we're going to switch gears a little bit and talk about illegal immigration. What is the court's position and responsibility on illegal immigration and healthcare? We kind of touched on that a little bit, but Mr. Jaynes, we'll start with you.
Primarily, we have pretty much said that we're only going to use common county taxpayer dollars to treat citizens. Our citizens are people who are here illegally, green card, that type of thing. We have a partnership with the Prime Care. We have our own county health clinic, and we also have a grant fund, $200,000 a year to private health clinics, volunteer health clinics. But that's always been our position, and I think a lot of people out there support that position. I think a lot of people just basically do not want to see their tax dollars going to being spent on people who are here in this country illegally, and I respect that.
Okay. Manuel?
I think this is a very hot issue when it comes to illegal immigration and how are we paying and how are we interfacing with that. I'm going to ask people to remember that an illegal immigrant's children are still going to be given public education by the state of Texas. They're still going to be given public education in McKinney schools. And what's going to happen is their child, if their child is sick, is going to go to school. Nurse says, oh, you've got a fever. Kid needs to go to the doctor. Well, no Collin County center will take care of that child, so that child's going to end up going back to school perhaps with a pneumonia. You have a danger of infecting other kids. Then you have the danger of that child's parents having to come off of their job, wherever it is that they work, and not tear down part of our workforce. Also, think about this fact that when we send these illegal immigrants to county-funded or grant-funded, really, because it's not just the county that's funding the nonprofit clinics. They're being funded by other nonprofit institutions. They're being funded by other institutions that want to give back to the poor. When someone goes to those clinics, they're being paid for pennies on the dollar. We are getting off cheap by sending them to these grant-funded clinics throughout the county. When we do that, we service a person locally, we service them cheaply, and we take care of the situation very quickly. And I believe when we start sending them to Parkland, where they end up at Parkland, if they can't get service here, or they end up at the emergency room of your local private hospital. And then again, it's costing more money, and the person who ends up paying for it is you. Because you're going to pay for it in your state tax dollars, or you're going to pay for it in your insurance premiums, because they will be increased to cover that amount that the hospital can't take care of.
Okay. Mr. Jaynes?
Yeah, let me point out that even though we're not spending taxpayer dollars on health care for illegal immigrants, we're not depriving any children of health care. 98% of children of illegal immigrants born here, they're called anchor babies. They're U.S. citizens, and if they meet 100%, their family meets 100% of the poverty level, we will treat them. That's the big issue, not whether the kids are citizens or not, it's whether their family meets that 100% of the poverty level. Family of four, $22,000 a year. Now, if they don't, we also, in our county health clinic, have a WIC program, Women, Infants, and Children, which is a federal program, which, one, doesn't look at immigration status, and two, it's 250% of the poverty level. So I don't think you're not going to see any children falling through the cracks just because of the policies we have adopted. There's plenty of safeguards there.
Mr. Manuel?
Well, there is a situation when someone's parents are not able to receive health care location. The parents are going to assume that their children will not be as well. And this is also a HIPAA issue, a Privacy Act issue, because as the county, we are not technically the medical provider for any single person who goes to a grant-funded county area hospital, a medical clinic. Yet we are expecting to receive private information, the type of service, their either driver's license or social information from these people. And that is a situation that's on the very edge of being legal when it comes to HIPAA laws.